In response to the COVID-19 public health emergency, the United States Centers for Medicare and Medicaid Services, CMS, has recently relaxed regulations in an effort to broaden access to telehealth services. This seems to be a big deal, but what do the relaxed regulations mean? Will Medicare patients actually have better access to telehealth services? It turns out that telehealth regulations need to be even further relaxed. Let's take a closer look and see why. I'm Dr. Robert Setapane. I'm a practicing allergist treating people of all ages, including Medicare patients. Join me for the next several minutes as we take a closer look at issues affecting access to telehealth services for Medicare patients. Previously, Medicare would only reimburse for telehealth services in rural settings where there was limited access to health care. But the newly relaxed regulations mean that Medicare will now pay for telehealth services originating from anywhere in the United States, including from the safety of a Medicare patient's home. So, what's so great about this change? It's potentially a huge improvement in healthcare access because most Medicare patients are typically over the age of 65. And this is the very age group identified by the CDC as especially at risk for severe illness from COVID-19. According to the CDC, 8 out of 10 deaths reported in the United States have been in adults 65 years and older. It's the Medicare age group that are at greatest risk. Because of the COVID-19 risk, those 65 and older should stay home as much as possible and avoid going anywhere, including a doctor's office. But many people in this age group have complicated medical issues that need ongoing medical management. It would be best if they could continue to receive healthcare services without having to leave their home. It's a great idea that Medicare beneficiaries might be able to receive a full spectrum of healthcare services from home, including mental health counseling, preventative health visits, and E&M visits. E&M visits are evaluation and management visits. These are the equivalent of common office visits. It is also very helpful that Medicare might treat these telehealth visits the same as in-person visits and pay providers at the same rate as regular in-person visits. However, the problem for many of the elderly patients is that Medicare telehealth services require two-way video communication. Current Medicare policy is that telehealth services require an actual two-way video connection. The concern is that Medicare won't pay if there is no video connection between the patient and the provider. Providers are unlikely to provide services when there is no mechanism for payment. On a technical note, Medicare-defined telehealth is not to be confused with Medicare virtual check-ins, which are very abbreviated, patient-initiated communications with a healthcare practitioner that do not require a video connection. Medicare virtual check-ins do not include the full spectrum of healthcare services. Medicare virtual check-ins are not an adequate substitute for common office visits. In contrast, Medicare considers telehealth visits to be the equivalent of a common office visit only when there is a video connection. Medicare's policy is that telehealth visits require a two-way video connection between the provider and the patient to be considered an office visit level of care. But most of the Medicare population has no personal experience with video communication. According to an AARP study in November 2017, only 31% of people aged 60 to 69 said that they had used a video chat, with the percentage dropping to 23% for people aged 70 and over. Therefore, it seems apparent that the requirement for a two-way video connection is a major obstacle for the majority of the Medicare population. The current Medicare requirement for video connection also creates a socioeconomic barrier to healthcare access because those at a lower socioeconomic level are less likely to have access to a video connection. If you are well off enough to be able to access a two-way video connection, you are able to access office visit level Medicare telehealth services. But if you don't have access to a two-way video connection with your provider, you won't be able to access office visit level Medicare telehealth services. Equal access to healthcare has always been an important goal. There is a very strong argument to be made that it is simply not fair to discriminate on the basis of access to two-way video technology when it comes to delivering healthcare services. It is imperative for the health and safety of the Medicare population that the barrier of a mandatory two-way video connection be further relaxed. Under President Trump's leadership, Medicare, CMS, has broadened access to Medicare telehealth services, but the requirement for a video connection is still a significant barrier to access. What is needed now is an executive order to temporarily eliminate the requirement for a video connection. It really comes down to this. Mr. President, please remove the video connection requirement for Medicare patients during this time of public health emergency. Please remove this technology and socioeconomic barrier to healthcare access. Please issue an executive order that would temporarily allow Medicare to cover office visit type services using a simple telephone connection. Many state governors have issued similar executive orders mandating payment of telephone-only healthcare visits at the same level as in-person office visits. The states are actually ahead of the federal government with regard to mandating health insurance coverage for telephone-only visits. Many state governors have mandated that telephone-only visits be billed using the same codes as in-person office visits so as to eliminate the tremendous billing confusion that results from different insurance companies requiring that different billing codes be used for telehealth type office visits. These same policy changes are necessary for Medicare during this healthcare emergency. However, state governors have no authority over the regulation of Medicare services. An executive order from the executive branch of the federal government is actually necessary to further facilitate access to Medicare telehealth services. The health and safety of Medicare patients makes it imperative that President Trump remove additional barriers to telehealth, which include the requirement for video connection and the requirement for different billing codes. Mr. President, please remove these barriers to telehealth services for Medicare patients. Please tear down these regulatory barriers obstructing Medicare patient access to office visit level services using a simple telephone connection. Medicare patients are waiting for you to make the call and issue additional executive orders further expanding access to telehealth services. Your continued leadership is absolutely necessary to resolve this very important healthcare access problem. Thank you for listening.